If you're experiencing persistent pain, tingling, or numbness in your hands and feet, particularly at night, you might be dealing with a condition known as neuropathy. This condition occurs when the nerves that transmit sensations to the brain and spinal cord are damaged. But can neuropathy be cured? Yes, it's possible to address the root causes and, in some cases, even reverse the symptoms. In this video, I'll walk you through the factors that contribute to neuropathy and the steps you can take at home to heal and regenerate the affected nerves. Neuropathy can manifest in various ways, from tingling and burning sensations to muscle weakness, numbness, and even difficulty maintaining balance. These issues arise when the protective covering of your nerves, called myelin, becomes damaged. The myelin sheath is essential because it insulates the nerve fibers and facilitates fast, accurate transmission of electrical impulses. Without this protective layer, nerve signals can become disrupted, leading to symptoms like those of neuropathy. The causes of neuropathy can vary, but one common factor is vitamin deficiencies, particularly in the B-complex group, vitamins B9, folic acid, B6, and B12. These essential vitamins are vital for nerve health, and a lack of them can occur for several reasons. For instance, poor dietary intake, especially if you don't consume enough meat, or the presence of intestinal parasites, can rob the body of necessary B vitamins, leading to nerve damage over time. In addition, certain medications, such as metformin, used for diabetes, or antacids, can interfere with vitamin absorption, exacerbating the problem. Other factors that may contribute to neuropathy include poor posture, herniated discs, aging, and more. It's crucial to understand that neuropathy affects not just sensory nerves but also motor nerves, which control muscle movements. When motor nerves are damaged, it can lead to muscle weakness, atrophy, or even paralysis in severe cases. Welcome to Healthy Life Channel, where we explore vital topics to keep you well informed and prioritize your well-being. Like this video if you're intrigued by natural health solutions. If you're new here, hit subscribe and enable notifications for our latest updates. In this video, I'll also highlight the warning signs that neuropathy might be progressing into a more serious condition, so you can recognize when it's time to seek medical attention. Additionally, I will share the most important vitamins, nutrients, and supplements you should be taking to treat neuropathy and support nerve regeneration, no matter your age. But be cautious, treating the symptoms is not enough if the root cause, like vitamin deficiency or parasitic infections, isn't addressed. With the right approach, you can improve nerve health and restore comfort to your hands and feet. 1. Lack of vitamins. One of the most common and significant causes of neuropathy is a deficiency in essential vitamins, particularly those in the B-complex group, which play a critical role in maintaining healthy nerve function. The key vitamins here include folic acid, vitamin B9, pyridoxine, vitamin B6, and cobalamin, vitamin B12. These vitamins are indispensable for producing and repairing the myelin sheath, a protective covering that insulates nerves and ensures proper signal transmission. Deficiencies in these vitamins can arise for several reasons. Dietary insufficiency, for instance, individuals who do not consume enough animal products, like meat or dairy, may lack sufficient B12 in their diet, as this vitamin is primarily found in such foods. Intestinal parasites. Another less obvious but common cause is the presence of parasites in the intestines. These parasites often do not cause noticeable symptoms, such as abdominal pain or diarrhea, yet they continuously consume the body's B12 stores over time. This silent depletion can eventually manifest as neuropathy. 2. Medication side effects. Certain medications are known to interfere with the absorption or utilization of these vital vitamins, leading to chronic deficiencies. Metformin, widely used to manage diabetes and sometimes prescribed for weight loss or polycystic ovary syndrome, PCOS, metformin can reduce B12 levels over prolonged use. Antacids, e.g., Omeprazole, medications for conditions like gastritis, gastroesophageal reflux disease, GERD, or stomach ulcers can impair the absorption of vitamin B12 over time. To combat these issues, it's essential to monitor vitamin B12 levels regularly, especially if you are on long-term medications like metformin or antacids. A simple blood test once a year can help detect deficiencies early, allowing for timely supplementation or dietary adjustments. Addressing the root cause, such as correcting a vitamin deficiency or treating parasites, is more effective than merely masking symptoms. 3. Nerve compression. Neuropathy can also result from physical compression or pressure on the nerves. This can happen for several reasons. Poor posture, spending long hours sitting, sleeping in improper positions, or repetitive activities like typing can lead to nerve compression. Structural issues. Conditions like herniated discs in the lower back may compress nerves, causing symptoms such as tingling or burning in the legs and feet. Similarly, nerve issues in the upper neck can lead to sensations like burning or numbness in the hands. Tumors. In rare cases, tumors in the spine can exert pressure on the nerves, causing neuropathy symptoms. Often, the compression is caused by muscle tension or contractures linked to stress, which can aggravate nerve irritation. If symptoms persist despite addressing other causes, consulting a healthcare professional to evaluate potential nerve compression is advisable. 4. Hidden infections. Some neuropathy cases are caused by hidden infections that quietly damage nerves over time. One notable example is Treponema pallidum, the bacterium responsible for syphilis. Long-term effects. This bacterium can remain dormant in the body for years before triggering symptoms. Over time, it inflames the body, damages nerves, and, in severe cases, may lead to both neuropathy and cognitive conditions like dementia. Treatment. The good news is that syphilis, even in advanced stages, can be treated effectively with antibiotics such as penicillin. 5. Other common causes and remedies for neuropathy. In addition to the medications like metformin and certain over-the-counter treatments I previously mentioned, there are other widely used remedies that can contribute to the development of neuropathy. For instance, did you know that taking high doses of vitamin B6 can actually cause nerve damage? This condition is called peripheral neuropathy induced by pyridoxine, the scientific name for vitamin B6. You might be wondering, didn't I just mention that B vitamins are important for reversing neuropathy? Yes, they are indeed crucial for supporting healthy nerve function, but there's a catch. While B vitamins help restore nerve health, excessively high doses can have the opposite effect, actually causing nerve damage. In such cases, the very medicine meant to treat the problem can become a source of it, leading to symptoms like tingling, numbness, pain, and muscle weakness, particularly in the hands and feet. So how can you tell whether you're dealing with neuropathy, and not some other condition? Let's explore the 4 most common symptoms of neuropathy, along with 3 warning signs that indicate the condition might be more severe. Tingling and numbness. This is often the first sign of neuropathy. You may feel a strange sensation in your feet and hands, like they're falling asleep, for no obvious reason. It can sometimes be a mild tingling, but in other cases, it may feel sharp and painful, as if you're being pricked with pins and needles. Some people describe the sensation as if they're walking on cotton or have lost feeling altogether. In more severe cases, it can feel like your feet or hands are in constant pain, either sharp or burning. This is what's known as neuropathic pain. I've had patients tell me their feet feel as though they're boiling. This sensation can improve with the right treatment. However, remember that neuropathy doesn't always cause pain or tingling. Just because you don't feel these symptoms doesn't mean you don't have neuropathy, and this misconception can even mislead doctors. Muscle weakness. Neuropathy often leads to unexplained muscle weakness. You may struggle to grip objects with your hands, or feel like your legs and feet are constantly weak, making it difficult to walk or perform basic tasks. This weakness can feel as if your muscles are perpetually tired and unable to function properly, but there's no clear reason for it. Balance and coordination issues. People with neuropathy often experience difficulty maintaining balance or walking steadily. It may feel as though you're walking on a tightrope or that your feet are slipping on a slick surface, even when there's nothing underfoot. This symptom is sometimes confused with vertigo, labyrinthitis, but it's important to note that the treatment for these two issues is completely different. Loss of sensitivity. Neuropathy can lead to a complete loss of sensation in the affected areas, typically the hands or feet. You may find that you can't feel anything at all, including temperature, hot or cold, or even pain. This can be especially concerning because it increases your risk of injury, since you might not realize if something harmful is affecting the area. If you experience any of the following, it may indicate that your neuropathy has progressed to a more severe stage, and you should seek medical attention immediately. Complete loss of sensitivity. If you can't feel anything, neither temperature, touch, nor pain, this is a serious sign. A total loss of sensitivity can lead to serious injuries, since you won't be able to feel harmful stimuli, such as hot objects or sharp objects, causing burns or cuts that go unnoticed. Difficulty moving or weakness. If your weakness progresses to the point where you can no longer perform simple tasks, such as walking, grasping objects, or even basic self-care, like brushing your teeth or combing your hair, it's a sign that the nerve damage could be more severe. In the worst-case scenario, this could lead to paralysis, where you lose full control of the affected limbs. Intense and persistent pain. If the pain remains constant, even after taking medication or supplements prescribed by your doctor, and worsens over time, this is a red flag. Chronic, unrelenting pain that doesn't subside with treatment is a serious symptom and requires immediate attention. If you experience any of these warning signs, it's important to address them quickly to prevent further damage and to improve your chances of recovery. Identifying and treating neuropathy early on is crucial in managing the condition effectively. To improve neuropathy symptoms and even support nerve regeneration, two key approaches are essential. The first is ensuring you consume adequate vitamins, nutrients, and, in some cases, supplements that naturally support healing. The second is to avoid anything that could further harm your nerves. If you don't take steps to eliminate these harmful factors, it will be much harder for the treatment strategies to have the desired effect. The first strategy, natural compounds for nerve health. Let's focus on 3 natural compounds that are crucial for improving neuropathy. The first is alpha-lipoic acid, a substance similar to a vitamin. It is naturally found in various foods, including red meats, especially organ meats like heart, liver, and kidney, dark green vegetables, broccoli, spinach, and chard, and also in dietary supplements. While our bodies produce alpha-lipoic acid daily, it's often in insufficient amounts, which is why supplementing can be beneficial. This compound is vital for the health of our cells, as it acts as a powerful antioxidant, helping to protect the body from the damaging effects of free radicals. In addition to improving neuropathy symptoms, alpha-lipoic acid also helps with blood sugar regulation, supports heart health, and has potential anti-aging effects. However, because we typically don't consume enough of it through diet alone, supplementation is often necessary. Research has shown that doses of 300 to 600 mg per day are effective in managing neuropathy with minimal side effects. The improvements usually start to become noticeable within 2 to 3 weeks, with continued improvement over time. However, there are 3 important precautions to keep in mind. Alpha-lipoic acid may interact with other medications, especially those used for diabetes or hypothyroidism, so always consult your doctor before starting supplementation. If you use insulin, alpha-lipoic acid can lower blood sugar levels, potentially causing hypoglycemia. Some people may experience mild side effects like nausea, digestive discomfort, or bloating, though these tend to be rare with the recommended dosage. The second natural compound that can significantly help with neuropathy is curcumin, the active ingredient in turmeric. Curcumin has been widely studied for its potent anti-inflammatory properties and its ability to support nerve health. It can also improve symptoms of chronic inflammation associated with neuropathy. The best way to incorporate curcumin into your diet is by adding half a teaspoon of turmeric to meals such as salads, soups, fruit smoothies, green juices, or even water. For optimal absorption, you should mix turmeric with black pepper, which enhances its bioavailability by up to 2,000 times. Alternatively, you can take curcumin supplements, which are often pre-mixed with black pepper for better absorption. A typical dose is 500 mg of curcumin, taken twice daily. The third important nutrient for nerve health is magnesium, which comes in several forms, including magnesium threonate, malate, gluconate, and citrate. These forms are particularly well suited for alleviating neuropathy symptoms. Magnesium helps to relax muscles and nerves, reducing symptoms like pain and tingling. There is more information on the specific types of magnesium and how to choose the right one in our video, which explains the differences and benefits. In addition to these three natural compounds, it's crucial to consume the essential vitamins from the B-complex group, particularly B12, B6, and B9, folic acid. These vitamins are vital for nerve function, and daily supplementation can help alleviate neuropathy. However, caution is needed because taking B vitamins in excess or incorrectly can worsen symptoms, so it's especially important to take them if you have risk factors for deficiency. Another critical nutrient for nerve health is omega-3 fatty acids, found naturally in cold water fish, like salmon, or fish oil supplements. Omega-3s help reduce inflammation in the body, which is crucial for nerve repair and function. If you take omega-3 supplements, ensure they contain EPA and DHA, the key fatty acids for nerve health. The second strategy, avoiding harmful substances for the treatments to be effective, it's essential to avoid certain harmful substances that can worsen neuropathy symptoms. Here are 5 main culprits to watch out for. Alcohol. Regular alcohol consumption can significantly hinder the healing of neuropathy, so it's best to avoid it entirely. Sugar. Excessive sugar intake exacerbates almost all neuropathy symptoms. Reducing sugar consumption can bring noticeable improvements in nerve health. Inflammatory foods. Foods that cause inflammation, such as ultra-processed foods, unhealthy fats, like fried foods and margarine, and certain vegetable oils, can inflame both the body and the nerves. Avoiding these is crucial for reducing neuropathy symptoms. High-sodium foods. Foods that are high in sodium, like those from commercially prepared meals or packaged snacks, can increase fluid retention, causing swelling and worsening neuropathy symptoms. Limit these foods as much as possible. Allergenic foods. Certain foods may trigger allergic reactions that cause inflammation. Identifying and avoiding these allergens can help reduce overall inflammation and improve nerve health. While neuropathy might seem like a challenging condition, there are plenty of natural and effective strategies to relieve symptoms, regenerate nerves, and restore your quality of life. It doesn't matter how long you've been dealing with this condition, you can start improving today. Make conscious decisions to add the right nutrients to your diet, avoid the harmful substances that damage your nerves, and stay consistent with your treatment plan. Remember, your body has a remarkable ability to heal itself when given the proper support. You are not alone on this journey. The road to recovery starts now. Take charge of your health, invest in your well-being, and reclaim control of your life. You deserve to live free from pain, with energy and vitality. Your future begins today. Choose to prioritize your health and well-being. Thank you for staying with me until the end of this video. Your support means the world. If you found this information valuable, please like this video, share it with your family and friends, and subscribe to our channel to stay updated on future content. Don't forget to turn on the notification bell to ensure you never miss any of our health and wellness tips. Take care of yourself, and prioritize your health. You deserve it.